traditionally, we've been speaking about medical deserts in rural and remote areas. So let's say a place like Lapland, but increasingly, because of the changing demographics and the pressure that are posed on the healthcare system, particularly highly populated areas, so in large cities, where there you can actually, or you can find neighborhoods within those cities where there isn't enough medical specialists, or there's an increased demand for healthcare services, and simply hospitals or healthcare providers are not able to cope with that. Now, they might be able to cope with that demand, but maybe they won't be able to do it in the required time. So there where we have the waiting times. And by the way, this is really an increased problem in Finland. There are increased waiting times for specialized services, for certain surgeries, where you need to wait maybe 6 months or even more to get the service. And of course, in other countries, we talk about a lot of other problems, but what I want to emphasize is that we talk about medical deserts in highly prosperous, Finland being the happiest country in the world. So even here we've got medical deserts. There might be different causes and different solutions to it, but medical deserts exist even in a country like Finland. Well, there are multiple consequences. If a patient does not get the service on time, that has a host of implications. So, immediately we can talk about waiting time, so they will have to wait longer, and that also has implications. Sometimes life and death, sometimes it's a matter of time, you can actually wait, but sometimes it's not possible to wait. And ultimately, it affects the well-being and just the welfare and the well-being of people in a society or in an area. So it's a severe problem. It's not something to be dealt with lightly. But unfortunately, sometimes policymakers, though they understand what the causes and what the solutions might be, they don't actually act on time or in the right way. It seems to me that there's been increased awareness of medical deserts. There's pressure from people, not just in Finland, but in other countries where people are calling their authorities saying, I have to wait 6 months or even more. Or there are so many cases. I just heard of news in Tampere, for instance. There's a long waiting lines for mental health care services for young people. We can understand that in this context, why that is important. So people have to wait. They don't get the service on time. And that's really, you can ask why. We've got expensive, we live in Northern Europe, where you've got I would say, highly expensive welfare system. We've got all kinds of services being provided. Why can't that service be delivered? Why can't it be delivered on time? We can think about how it's organized. Is it that we don't have enough resources, or is it that maybe we don't use the resources in the right way? Maybe there should be more use of telemedicine, where some services are provided remotely, and a host of other kind of interventions that could be put in place. But you need to have a system that is well organized, addresses the root cause, and tries to provide solutions to the problems as they are identified.